Hello, everyone. My name is Jeffrey Walton. I'm the editor-in-chief of Chain Drug Review and Mass Market Retailers. Welcome to our video forum. We're thrilled today to be speaking with Rick Keys, who is the president and CEO of Meijer, and just in the last couple of months has become chairman of NACDS. Rick, welcome.
Well, thank you, Jeff. It's great to be with you, and have really enjoyed these videos that you've been putting together for the industry. So thank you for that.
Well, thank you. I appreciate that. Maybe we'll talk a little bit about Meijer, but mostly about NACDS this go around.
Sure.
Maybe you could talk about what your priorities are in this very difficult and challenging year.
Well, these are difficult times, and we certainly came into the year with a set of priorities, but with the COVID-19 pandemic and really the need within our country for a response, I mean, that quickly became a top priority for the industry and our profession. And so we've been working very hard, working legislatively to clear the way for our pharmacies to practice at the top of their license and to really make a difference. So I think COVID-19 has really been a key issue for us, and I've been really proud of the industry and our member companies and how they've responded. But that doesn't take the place of some other key priorities that we want to make sure that we stay focused on. And so certainly when you think about DIR fees and the reimbursement issue, the crisis that we have in our industry, that remains top of mind. And we talk about that in every single call and every single meeting that we have with our legislators and administrators. And, you know, one of the things that, we don't want to forget about, and I think has not been getting the news and the coverage that it once was because of COVID, is, the opioid abuse epidemic that is still out there. And I have some real concerns about that, and even just implications of COVID and quarantine and lockdown and recession from an opioid perspective. And we've done a lot of great work there, and we want to continue that. And, we're looking at the scope of practice and constantly staying focused on how do we continue to expand the scope of practice. I think you'll see that as you move forward with the work we're doing with COVID-19 and this pandemic. What an opportunity to express the great work that we can do as pharmacists working at the top of our license to help make a difference in this area. And so lots of great work there. And as always, continue to really be fortunate. We've got such a great industry association here led by Steve Anderson at NACDS and the outstanding team that do just an excellent job of connecting our member companies with our suppliers to really work together to make a difference in the industry. It's really one of the best industry organizations in the country. We have an outstanding board of directors that meets regularly. Very blessed to have that team to work with as we take on these challenges, but challenges nonetheless, but we're up for it.
Mm-hmm. COVID-19 obviously has changed everything for retailers and pharmacy operators. Maybe you can talk a little bit about how you think you at Meijer and also the industry as a whole have responded to the challenge of meeting consumer needs under these conditions.
Sure. I would say, first and foremost, thank you to the pharmacists, the pharmacy teams out there that have just done a tremendous job responding to what was an unprecedented challenge that was put before us. And so, as essential operations within the country and critical component of our healthcare system, it was absolutely important that we were able to stay open, to be able to stay connected with our customers, to put them at ease, that we were going to be there to take care of not only what comes with COVID-19, but you think about the routine medications that are necessary. It is absolutely critical that we were able to operate. And what you saw in our company at Meijer or across the industry, I mean, stepping up with the sanitation practices, the 6 feet distances, and making sure that we were signing and making that clear to our customers, the sneeze guards, the health screenings that I think, the pharmacy industry was one of the first to put in place, where we are health screening all of our employees before they come into work. I think the teams really did step up. They kept their operations open. We've been able to take care of our customers and patients. And I think that's really gone a long way in the country to ease anxieties and pressures. And I think, you'll see as this continues to move forward, whether it's testing or vaccinations, there's an incredible role that we can play there to really help reopen our country and to keep our country and our economy moving forward.
Are customers comfortable these days coming into the store?
Yeah, it's interesting. I know from our own perspective, you have waves of anxiety, et cetera. And I think certainly when the pandemic hit, we all saw the fear and the anxiety, the panic buying. There was a lot of information back and forth, what made a difference, what doesn't. I mean, certainly recently, the topic of masks and getting those mandated across the country, especially from retailers. I think retailers and pharmacies did an outstanding job of stepping up and saying there may not be a mandate in our state, but we are going to require masks to be worn inside of our facilities, not only to protect our customers, but also to protect our team members. And so, we see that ebbing and flowing. I would say right now, anxiety is starting to build a little bit as cases are becoming more prevalent, certainly in those states that are seeing the spikes. But I think we're also seeing that if you practice the safe practices that are out there, wear the mask, sanitation, maintaining 6-foot distances, cleaning your hands, washing your hands, that you have a pretty good chance of not catching COVID-19. And then we're also seeing one of the things that I'm really pleased to see is the outcomes that are taking place inside of our hospital systems. They seem to be much more prepared. The readiness is there. We certainly are more prepared at Meijer. So I think our ability to respond is much better than what it was before.
Mm-hmm. And when you say you're better prepared at Meijer, can you be a little more specific about what you mean?
Well, I would say, we were all on our heels a little bit. There's nothing that could have prepared us for what we saw when this kicked off and when it started. And so now, whether it's staffing, whether it's our sanitation procedures, our ability to keep our team members and our customers safe, the supply chain, the flow of product through our supply chains, which all of us were stressed in those areas where we saw a doubling of our business initially and then still have seen a continued increase in business. I think we're all much better prepared. And then I think the integration and communication and transparency with the other components of the healthcare system is so much greater now. I mean, we have a clear understanding of what's happening across the system in our hospital networks. Testing, the availability of testing is so much more readily available. And then the other one, which we found incredibly valuable at Meijer, is contact tracing. So the ability when we do see a case to really do the tracing and make sure that we're able to pinpoint and get people out of the workforce that potentially could have been exposed. And so we're so much farther advanced than where we were in March. And I think it prepares us for that second wave that we all feel is upon us.
You touched on vaccines and also obviously screenings. What kind of role do you see pharmacy playing in this public health crisis and then going forward?
Well, I talked about it earlier. You think about practicing at the top of our license. As a pharmacist, you always wanted to be able to practice at the top of your license. And you think about this crisis that we're in and the ability for pharmacists to step up and to help. And I think anytime we've seen a crisis, this industry has responded. And we want to, once again, be able to respond in a way that really makes a difference. And what I would say is that NACDS moved quickly as this pandemic broke out. We met with legislators, administrators, the administration to really work to get access, the ability to be part of the solution from a testing standpoint. And so the legislative teams led by Steve, the board really stepping up to get that capability. Secretary Azar really giving the access to pharmacists to actually do the testing. And kudos to many organizations, many pharmacies across the country that have stepped up to do testing. So you think about Kroger, CVS, Rite Aid, Walmart, all stepping up. We now have thousands of testing sites that are out there where we're part of the solution, part of making those tests available. We are working and continuing to work to expand that. So right now we only believe about a quarter of our pharmacies are able to actually do this testing. We think that there's more work to be done to be designated as mass testers. And then we're also working on the ability to be reimbursed appropriately so that this is sustainable. And I think that's another issue that you'll see NACDS taking to the Hill and really working on behalf of the industry.
Let me ask you another question, Rick. Obviously, Meijer is a major food retailer as well as being involved in pharmacy and healthcare. How are you trying to tie those two portions of the business together for the benefit of patients and customers?
Well, I think healthcare and nutrition go hand in hand. And so, yes, we are focused in the food area, and our company was built and founded in food and grew in to be the first supercenter in the United States and really have a prosperous business. But, pharmacy has been a critical component of our strategy for as long as I can remember. I've been with Meijer now over 30 years, and that relationship with our customer is absolutely critical to our success. And we believe that healthy offerings, healthy, fresh offerings, as well as communication and transparency around those things that are healthy for you, combined with the tremendous care that you receive in our pharmacies, really leads to better outcomes. We're doing a lot of innovative things. As we work with our local healthcare systems, we actually have opened pharmacies inside of actual hospital systems, one here in Spectrum Health here in Grand Rapids. And we're also working with other hospital systems to actually be there on the floor as patients are being discharged, so that as they're leaving the hospital, we can connect them, one, to their medications, but two, to healthy products that they can purchase in our stores that are going to help improve their outcomes. And so, we see this interconnectedness, and I think you see a lot of that. I saw that even in Alex's comments in your interview with Walgreens. I think they're doing a lot of things there to say, hey, this isn't a one or the other. These can be connected, and we know that we can improve outcomes if we can improve compliance to the medication protocols, as well as connect them to healthy products across our stores.
DIR you mentioned as being critical, and we've been fighting that fight for a number of years. Where do things stand? Is there any relief in sight?
Well, I think, as we came into the year in 2020, that was one of our top initiatives, and it still is an issue. It's something that we talk about regularly. It's at the top of our list as we're meeting with all of our representatives. We see it as an existential threat. And one of the beauties of pharmacy in our country is the accessibility. And if we cannot create a financially viable system for pharmacies to exist in rural, urban, suburban environments, we think that really threatens healthcare in the United States. And so, we've seen over the last couple of years, over 2,000 pharmacies that have had to close. And so this is something that we continue to talk about and work on. I will tell you, even last month, we had our virtual fly-in in Washington, D.C. That was at the top of the list as we talked to every one of the representatives that were there. There is general agreement that this is something that has to change. I think the challenge right now is figuring out how do we get that across the goal line, whether that's legislatively or administratively. How do we get changes put in place? And so we regularly hear back from the senators and congressmen as well as administrators, hey, there's got to be a way to fix this. And that really is the challenge we have ahead of us, is to take a general consensus and get that across the goal line and find a way to fix that permanently so that we can continue to move forward. And I think all that we're asking for is a fair and transparent transaction.
Doesn't seem like too much to expect.
No.
Let me ask you this. The president recently has made some noise about drug pricing and such. Do you hold out much hope that maybe some relief will come in that regulation if indeed they do issue one? I know they're very unpredictable.
Well, we're hopeful, and we've been talking to the administration. They certainly understand our position and where we stand on that, and we've been working with them to be part of that solution. Going into an election year, one of the promises that was made was around drug pricing, and so we're hopeful that starts to manifest itself in some meaningful, and that's really what we're looking for, is some meaningful change. Mm-hmm. And I think, we're hopeful. We're going to be at the table. Working with them to get that done. And I think that we will see something come in the next couple months, especially going into an election.
Mm-hmm. You mentioned earlier the opioid epidemic, which of course continues, and by some accounts, I guess, has even gotten worse during the COVID pandemic. What should NACDS members be doing to keep that top of mind and try and help people cope with this problem?
I'm glad you asked that. I think this is one that we really have to be deliberate about and really keep our focus on. This is a devastating crisis that we saw building over years, and pharmacy really is part of the solution. We really believe that. We make a difference here. I'm so proud of our member companies and all of the creative ways that they've stepped up and stepped into the gap here and said, hey, we can really make a difference. At NACDS, we have a comprehensive plan that we have submitted that goes through a number of different steps that can be taken and that have been taken by our member companies, but we do need to continue to get nationwide support. So when you think about e-prescribing and making that prevalent across all of our states, a nationwide drug monitoring plan that we could put in place. We've already worked on and put limits in those initial prescriptions and the amount of product or amount of drugs that are being put into those initial prescriptions that we know end up in the medicine cabinet and then end up diverted into the wrong hands. A lot of our member companies have gone out and put drug disposal programs in place. I know at Meijer, we put that in across every single one of our stores and have just been overwhelmed by the positive response that we've seen in the communities where people see this as a challenge and want to participate. When you think about the fact that we have over 60,000 pharmacies in the United States, 180,000 pharmacists, I mean, we stand at the ready to really make a difference here. And so we need to continue to talk about this. I worry a bit when you think about the environment that we're in. You think about going into a recessionary environment when many people are losing their jobs. You think about being quarantined and mental health and the challenges from a mental health standpoint, all are going to exacerbate what was already a challenge. And then you think about the budgetary challenges that our states are under. How do we work through that so that the critical programs that support preventing this from moving any further do not get cut? Those are going to be critical challenges for us as an industry as we move forward.
Rick, you were trained as a pharmacist and began your career at Meijer in the pharmacy department. How do you think the experience of COVID will change the prospects for pharmacy, particularly in terms of expanding scope of practice?
Well, I take great pride in being a pharmacist, and one of the things that we have seen over the years and continue to see is we are one of the most trusted healthcare professionals in the country, and I think that only grows and widens as we've gone through this pandemic. I think people have seen pharmacies step up. They're seeing us be there for them from a testing standpoint, vaccinations, which we didn't talk about. But I think that is going to be absolutely critical. If you think about the challenge we have ahead of ourselves, the first threshold is getting a viable vaccine. Mm-hmm. And then from there, we're going to have to move to vaccinate hundreds of millions of people in the United States. And the pharmacist can play an absolutely critical role in administering that. The CDC has come out and did a study and said that, if we were to vaccinate 80% of the population, by utilizing pharmacies and pharmacists, we'd be able to do that 7 weeks faster. Mm-hmm. I don't know about you, but 7 weeks is a long time. And I know we're all going to be looking for ways to get that vaccination across our country. And so I think as we administer these critical testing capabilities, vaccination capabilities, I think people are going to continue to see that their most trusted healthcare professional has a lot more to offer. We did a study recently, I think 86% of patients out there saw pharmacists as a key player in the vaccination space. And so things like that, I think, just further enhance the great work that's being done. And the beautiful thing for me, representing this great industry and working with NACDS is you're representing a group of people, a group of professionals that really are making a difference. We don't have to make this up. They're living this each and every day in their pharmacies and their communities, rural, urban, and suburban, making a difference in their communities. And to be able to represent that group is really an honor and a privilege.
Yeah, I think people are saying that today more than ever.
Absolutely.
Thank you for your time. It's been a pleasure.
You're welcome. Thanks, Jeff. Anytime.